So today we're going to be doing a full cranial nerve assessment. For cranial nerve 1, it is the olfactory nerve, and the way I would test that is I would have her smell something. So I have a candle here that I'm just going to ask her to smell. I'm just going to make sure that you can smell. Yeah, just make sure that she can smell. Cranial nerve 2 is going to be the optic nerve, so I would just test that by having her read a sign. So there's a sign behind the camera over here. Can you tell me what that says?
Sporting Green Champs.
Okay, so that one's all working. For cranial nerve 3, it's the oculomotor nerve, and so the way that I'm going to test that is by using a pen light and testing her pupil response. So I'm just going to have you look straight ahead from me, and I'm just going to shine this light over in your eye, making sure that they are equal and that they restrict with the light, and they do. So that's cranial nerve 3. For cranial nerves 4 and 6, you can test them together. Cranial nerve 4 is the trochlear nerve, and cranial nerve 6 is the abducens nerve, and those are just eye tracking their movement. Trochlear is for up and down, and abducens is for side to side. So the way I'm going to test that is just with a bow tie. So I'm going to have you look at the tip of my finger over here, and I want you to follow it with your eyes and do not move your head. So I'm just going to come this way. And I'm just looking for her to be able to follow my finger and just make sure that the motion is smooth and normal. Okay? And then cranial nerve 5 is the trigeminal nerve, and so the way I would test this is I would just ask her to bite down for me. There you go. Cranial nerve 7 is facial, so this I would test for, it's both motor and sensory, so I would ask her to smile. You can frown for me. And then, do you mind if I touch your face?
Okay.
I'm just going to make sure that sensation is the same on both sides. And then for cranial nerve 8 is the vestibular cochlear nerve, and so this is tested for 2 different ways. First, I would just make sure that she can hear this. Clearly she can hear it and it's sensitive.
Touched me!
Oh, I'm sorry, my apologies. And then the other way I would test cranial nerve 8 is for balance. So I'm gonna have you stand up for me, and then I'm gonna have you stand 1 foot in front of the other, heels touching toe, hands on your hips. Then she's able to do that, so then I ask her to just close your eyes. And makes it a little bit more difficult, but for the most part she's still able to balance. And then I'm gonna have you sit back down. For cranial nerve 9, glossopharyngeal nerve, I'm just gonna ask her if she is able to swallow.
Yep.
Okay. And then cranial nerve 10 is the vagus nerve. For this, I'm just gonna have you say testing her gag reflex. And then cranial nerve 11 is the accessory nerve. So I'm just gonna have her shrug her shoulders. And then cranial nerve 12 is the hypoglossal, and then I'm just gonna have her move her tongue around.
Blah.
So for cranial nerves 9, 10, and 12, they can kind of just be tested as you're doing the exam, just making sure that she's able to talk back to me, she's not drooling, and that her face is moving and not having any issues. So there's a cranial nerve exam. Today we're going to be doing an upper extremity neurological exam. So I'm going to be going through the dermatomes and myotomes of the upper extremity. So starting with dermatomes, I'm just going to feel C4 sensation. Does that feel the same on each side?
Yep.
C5 sensation.
Yep.
Here, if I can have you pull your arms out like this. C6 is going to be thumb and index finger. Does that feel the same? C7 is going to be middle finger. Does that feel the same?
Mm-hmm.
C8 is going to be pinky and ring finger. Does that feel the same? And then T1 is going to be medial elbow. Does it feel the same?
Mm-hmm.
Then going into myotomes, I'm going to have you shrug your shoulders. Don't let me push you down. C5 is going to be chicken wing. And don't let me push you down. C6, I'm going to have you pull your arms this way. And don't let me pull. There you go. And then C7, keeping this position, but this time you're going to push against me. And then C8, I'm going to have you grab my fingers. Don't let me pull them out. And then T1, I'm going to split your fingers and I'll tilt them that way.
Okay.
So if I have a male athlete come up to me during a game or a practice that says that he took a hit to the groin and that he's starting to feel nauseous, my first worry is going to be testicular torsion. So if he's feeling nauseous, I'm probably going to make sure that I have a trash can around just in case he feels like he's going to throw up. then I would just kind of just ask him for his privacy, and we're in a stadium and there's a lot of people around. I wouldn't physically be doing the exam myself. I also, in any time, want to be doing the exam myself. It's going to be a self-exam. But in this case, I would just have him kind of like feel around himself, like feel his abdomen and feel like his groin, like his abductor muscles, just seeing if there's anything different. Are you tender anywhere, anything like that?
No.
No. Okay. So then from there, if he's still feeling nauseous, I would probably remove him from the sideline and go into like a locker room or a bathroom. I would also probably bring one person with me, just so that way there's someone else in the room. And I would have him go into the bathroom by himself. I could be standing outside the door just kind of talking him through what he's doing, but basically just asking him to make sure that everything looks the same that it would on a normal daily basis. If there's any bruising, swelling, if anything's shifted, or if there's blood or anything like that. I would also ask him if he is able to use the restroom, or if when he does, if there's blood in the urine. Those are all red flags that I would want to immediately send him to the ER for. If he's fine and he's not feeling nauseous anymore, I could probably wait until after the game to have him do this. And if he is fine and he says that everything's normal, then I would probably send him home, but just have him keep an eye on it and just have him let his parent or guardian know if anything changes, and that if anything does come up, I would just have him go to the ER.
Action.
So if I had a young female athlete coming to me telling me that she is sexually active with her boyfriend and that she noticed that she is having itching and burning down in her private area, I would just kind of pull her to the side and just have a conversation, just so I can kind of get a gist of more of what's going on. Is it a UTI, yeast infection? Does she possibly have an STD? So these are just some questions that I would ask her. I would ask her if she's ever experienced anything like this before. I'd ask her if she's had UTIs before, or if she's had yeast infections before, because once you have them, you're like more susceptible to keep getting them. So just kind of just asking about like that part of her medical history. I would ask, she disclosed to me that she is on the birth control pill, and I would just ask her if her or her boyfriend are using any other form of protection whenever they are being intimate.
Nope.
So then with that, I would just go ahead and just ask her more about like her personal symptoms. Besides the itching and burning, have you noticed like a rash or anything like warts, or something just doesn't feel right whenever you go to the bathroom? Like, does it burn when you pee and stuff like that? I would ask about her discharge, if she's noticed anything with that. Is it a different color? Is it smell different than normal? And then I would just also ask, just to make sure, I would ask if her boyfriend is having any symptoms as well, because then that would lead me to believe that there is a STI that could possibly be there.